Welcome. This is Dr. Benzinger on Health with secondopinion.org. Welcome to our program. Today we're going to be discussing depression, the ideas associated with it and what you can do about it. One of the first things I ask with any kind of disease process that you may be suffering from or you know someone you believe is suffering from it, because depression is potentially life-threatening and is a serious condition and is life-changing if not managed appropriately. The question I have is, will you choose to control your future, or will you not choose to do so and allow the disease itself to control you? Will you be controlled by the disease, or will you choose to make a difference? The whole point of this is just to challenge you to say, are you willing to do the things that it takes to make a difference in depression and maybe manage it yourself, save money, time, effort, and life quality by you doing all that you can to help yourself with professional help when necessary. What is depression? Simply when the downs of life outweigh the ups. Depression many times might be the diagnosis, where there's these big fluctuations, and it can be small, but they can be extreme enough to cause problems within your life. Approximately 19 million Americans suffer, 6.5% of the women and 3.3% of the men. Anyone can suffer from it at any time or any place, and it doesn't mean it's a lifetime issue. You can have depression for short periods of time in your life, or long periods, or a lifetime. The lifetime, of course, is the more extreme cases. Here's some of the symptoms of depression: guilt, conflict, sadness, irregular eating habits, poor sleep, or you sleep all the time, crying spells, decreased libido or overly increased libido in the other side on occasion. Working habits change, personal interest in taking interest of yourself as well as others. You just kind of lose that for some reason. Your loss of life interest. That's why they always tell you when they're worried about children that are taking medications or drugs that they shouldn't be, or using marijuana or drinking, as they withdraw from society. Signs of depression associated with it, whether it's guilt caused or otherwise. Possible inducers of depression are life-changing events. That's one of the primary things to consider. Is there genetic link? It's possible. The truth is that's not the thing to rely on, except for in very severe cases that are life-threatening, or they try to commit suicide, things like that. Those are issues. When you see real extreme mood swings, maybe that's something you have to really address on a quick basis. But otherwise, we need to try to work on why did it happen, find it out, and then try to support these people in getting back their quality of life. Possible inducers, again, loss of a spouse, job. I've got some people that lost their job and have never gotten back up. They're still not working. They're still not even close to getting back the quality of their life. Loss of their mother or father or other siblings. Marriage. Having a child. So married and getting a child. Having a child within the first year or two, that's very stressful. And then divorce that may follow after that. That does happen in our society. It's very hard on people, and we just expect people to pick up and get on. And often depression can inset in those situations. Medical illness or chronic pain. We know chronic pain over a year, 98% chance of having some form of depression. Life stresses take its toll. They just beat you up. And at the end of pregnancy, we don't want to ignore postpartum depression, which is a big issue, and is on our site at secondopinion.org that you can look at Postpartum Depression for Dummies. It's a great book written by a phenomenal lady that really cares, and there are certain societies and organizations out there that you can pull in more information from. Possible inducers also might be brain chemistry of serotonin or norepinephrine, changes in the brain itself. Interesting, they can't just take spinal fluid and check and then say, oh, you just have not enough norepinephrine or you don't have enough serotonin. Interesting. Some reason they can't really clearly define it with diagnostic tests, but they know you have it. They know you have it based on your symptoms. So if you don't have the symptoms and you aren't acting out like you are, possibility depression is not the real condition. So keep in mind, there are over 100 chemicals that we know little about in the brain, so it's hard to prove and isolate that that's the sole issue. So sometimes when somebody hears depression, they don't want to hear it, because if they hear depression, they think they're going to have it the rest of their life and they'll never get out of that pigeonhole. Well, that's not true, except for in very severe cases, okay? Keep that in mind. What types of depression are out there? In just standard depression, there's dysthymia. Long-term chronic persistence of the same symptoms as with other types of depression, and moderate to severe depression, more intense symptoms that decrease a person's capability to function in life. The other one is bipolar depression, which is manic depression and depression itself. Look on the site, you'll find more information on that condition. We've covered that. It's not frequent, but goes through a series of depression and elation type of things. In other words, they act like two different people. And remember, it's covered on a different segment, bipolar depression. Postpartum depression occurs after birth and is potentially very serious for the baby, for the mother, and for the family, and it needs to be addressed in an aggressive manner. Okay, postpartum depression, baby blues. I'm just giving you an overview so you have some idea. Sudden mood swings, happy, sad, may feel impatient, irritable, restless, anxious, lonely, and sad. Usually last a few hours to a few weeks and may need medical attention. But PPD, postpartum depression, the true diagnosis, may happen a few days or a few months after birth. Symptoms are the same, but more severe, and most often should get help in a much more aggressive fashion. The entire family, again, is involved and needs to be involved in helping this person get through it. Depression increases other diseases. Interesting enough, it's not just depression we're worried about, it's the other diseases you can suffer from because of the depression. And arthritis is higher incidence in depressed people. Obesity, heart disease, other mental issues can occur or develop. Asthma seems to get worse. Cancer's predisposed. HIV viruses, hypertension, diabetes, and potentially death. So depression can lead to lots of other things, just like diabetes, just like other conditions. Obesity can. So it's something to be taken serious and aggressively go after. So will you choose to control your future, or will you be controlled by a disease? It's a question. Conservative treatments for all mild to moderate cases. Work hard to find one of these qualified people before you are just put on a medication without the right help. 85% of the time, doctors don't even recommend counselors, qualified assistants, to be able to work through the reason you got the depression in the first place. The pill is just given to you. Well, the truth is we have side effects to giving somebody antidepressants. And the truth is most of us don't want to be on that. Severe cases are the exception. But mild to moderate cases need to find a qualified therapist, counselor, minister, psychologist, or psychiatrist first, in conjunction with medications or without medications, depending upon what the doctor's evaluation is. But ask them. Don't just take, oh, doc, you know, I know, am I mild or moderate? What do you think? Well, I think you're probably a mild case. Well, I don't feel suicidal and I feel pretty good and I'm showing no other tendencies, and the spouse goes, yeah, he seems to be okay. Well, why not try a counselor first? Why am I being put on that? Can I try counseling first? Because I think it's because I lost my job, 3 months ago and I've just not gotten over it. People know, you know it's because you're drinking 2/5 every day and you're running yourself into the ground and now you're depressed about it. I mean, people know, or they have a good idea. The problem is we need to get them to who they really need instead of just popping a pill and acting as though it's going to go away, because most of us find out it doesn't go away, does it? It just stays there and eats at us. Other conservative treatments to actually consider: energy work, exercise. Put that on a pedestal. Exercise. The more you exercise, the less depression most people have, according to several articles that I've read. Guided imagery, okay, light therapy, mostly in December, January, February, very helpful because the lack of sunlight can affect certain people. Okay, massage, meditation, can't say enough about that. Omega-3 fatty acids, okay, fish oils really do help in higher doses, by the way. SAMe, yoga, acupuncture, nutritional support. Stay nutritionally healthy. Sometimes that's the only reason. You're just tired all the time. You're tired and you're hurt. So thus you need chiropractic care or Ayurvedic type of care. You need herbs, homeopathics, or maybe you need natural hormone replacement and you're of that age and you know your hormones are off and it's making you down, creating that and maybe some anxiety. So get to those types of care programs. In moderate to severe cases, medications or temporary use of medications might be a mandate, and if so, that's something you consider. In very severe cases, when nothing else works, electroconvulsive therapy, shock therapy, quote unquote, can be tried. Okay? So depression, recognize the signs, don't ignore them, ask and seek treatment quickly, and the longer depression lasts, the more likely you are to get other diseases and possibly die from the side effects of depression. Serious? Very serious. Hopefully you've enjoyed our coverage of depression. share it with other family and friends. Let's try to help each other, make a difference, to empower you to take care of yourself. This is Dr. Benzinger on Health with secondopinion.org. We'll look for you next time. Make sure you go to our site, secondopinion.org, sign up for our newsletter, know exactly what's coming up. It'll keep you educated, up to date with the best in the world discussing their favorite topic matters so that you can get help and encourage each other to control your own future. This is Dr. Benzinger again. We'll look for you next time. May God bless you.